so my name is Penny.
So I just wanted to give a brief background of this presentation. So it was a task that was set by the university. So that is the off-the-job training side of things. And once you watch the video, you'll see that I've made many different videos and I've edited it into one video. So I was actually going to do this again, and this was supposed to be me just practicing, but I decided to use it for my presentation. And also, since it's not marked, I decided there's no point me making so many videos as I've got a lot of other work to be getting on with. Anyway, I hope you enjoy it. And I hope that it helps you understand my work better and the type of work that the university would set, and just basically what's expected of a trainee clinical associate psychologist.
Today I'm going to be talking about a psychometric measure which my service use. It's called ReQol. So ReQol stands for Recovering Quality of Life. The ReQol outcome measure can be used for individuals aged 16 and over. The ReQol was used to assess the quality of life with patients with mental health conditions. So I've decided to look at the 10-item measure. So with ReQol, there's a 10-item measure and there's a 20-item measure which clinicians can use. So the clinician would basically choose the measure due to their needs. For example, if the clinician wanted to measure weekly how the patient is doing, they would use the 10-item measure, as this might be seen as more suitable and more reliable and valid to use weekly, and also because it's more time efficient. To monitor the patient's progress. So the items are related to mental health. There is one item which focuses on physical health, both in the 10-item and the 20-item measure. So the ReQol looks like this, the 10-item measure. It has 10 statements, and each statement has a rating of 4, 3, 2, 1, and 0. And the patient will be able to tick which applies to them. So, for example, a rating of 4 says none of the time. A rating of 3 would be only occasionally. A rating of 2 means sometimes. A rating of 1 means often. And a rating of 0 means most or all of the time. So, for example, the first statement is, I found it difficult to get started with everyday tasks. So they would rate it 4 or 3 or 2 or 1 or 0. So that's the ReQol. I actually found it quite useful and, like I said before, time efficient. I think it measures how the patient is feeling, their thoughts. So there are statements, for example, I feel irritated, or I felt like a failure, I felt in control of my life, I felt anxious. So it is measuring their thoughts, their feelings, and even the activities that they're able to do. For example, I did things I found rewarding. I would say the ReQol is user-friendly recovery measure. I think it's easy to use. So the strengths of the ReQol, it could be used for care planning. It's free to use. It has also been tested by 6,000 service users and is a psychological tool. So the scores can also easily be calculated, which is really good. I guess the flaws from this measure, it has tick boxes, so we don't know anything further than what they've ticked. And some of the terms may not actually be applicable, so they might rate themselves as to what they think their clinician wants to see. or what they think would present them more favorably. So so there could be an effect of social desirability bias. Overall, I think the ReQol is a really good measure. It has been used in many studies. A lot of studies have spoken about the strengths and how reliable it is for their study, and how accurate it was in terms of getting a good overall picture of the patient's recovery and their quality of life. So yeah, I will be using this measure in terms of looking at the quality of life with mental health patients. I really hope you all enjoyed this presentation and at least learned something if you're not familiar with the ReQol. Thank you so much for watching this video.